vaccine, which is now being seen as less effective against South Africa's COVID-19 variant. And we joined on the line by health reporter at Bhekisisa Centre for Health Journalism, Aisha Abdool Karim. Aisha, welcome to the show and great having you with us.
Thank you so much for having me on, and good morning to all your listeners.
Right, Aisha, let's talk about this vaccine because we know at one point in time there was a race to get the vaccine out into the global public domain. Right now, we are now seeing this discussion taking place as to which vaccine is more effective than the other. And in our case, we had, with all the fanfare and all the hype that was created with regard to the AstraZeneca vaccine arriving in South Africa, and now we see question marks being raised in terms of effectiveness.
Yeah, so I think, it's important to realize that the situation that we faced last year is very different to the one that we currently find ourselves in. And as we've experienced over the past year, there's a lot of things that we don't know about this virus and we learn as we go. And so I think that there was extreme pressure to procure a vaccine. There was a lot of hope put on the vaccine because of the devastation that we've seen caused by this virus and because of how bad the second wave was, especially in this country. And so when we procured the AstraZeneca Oxford University vaccine, at that time, we only had limited information. And as was announced last night, we now see that there is new data coming out that shows that this vaccine is essentially not able to offer sufficient protection or much protection at all against the variants that we currently have circulating in this country. So we procured these vaccines because they were going to really help with reducing severe disease and potentially with reducing transmission of this virus within our society. And unfortunately, it does look like, at least for mild cases of this disease, the AstraZeneca vaccine won't work. However, I just want to, add that we still don't know what these results mean for severe cases of the disease, which is really the priority when it comes to vaccination, because ultimately in South Africa, what we're looking at out of our vaccination program is we want to reduce the burden on hospitals. We want to reduce the amount of severe cases of disease, which is, people that are being hospitalized. And at this point in time, we simply don't have information on enough vaccines to categorically say, which one is the best to reduce severe disease against the variants, because that's still something we have to wait for. Those are answers that we don't yet have.
Now, the key issue here is we've procured the vaccine, we've purchased it, we've paid for it, and the vaccine is in South Africa at this point in time, which we know is going to be rolled out, and we're looking at people in the front line who will be receiving this vaccine. This discussion that is taking place on its effectiveness, is this likely to impact on the rollout and what the immediate or the short-term plans are as far as this AstraZeneca vaccine goes?
Yes, so I think, the new information that we have about the efficacy definitely means we have to rethink South Africa's vaccine strategy and our rollout. And the plan, as it was announced yesterday evening, is essentially what we're going to be doing is something called an implementation study alongside rollout. So what that means in the simplest way possible is that healthcare workers are still going to be getting vaccines. They are still the top priority when it comes to immunization. And that's because, as I mentioned before, our really key is to prevent severe disease in the most vulnerable groups. And then the healthcare workers are frontline, and they are essential to making sure that the healthcare system doesn't collapse when we have a potential third wave coming into the country, which we are expecting in a few months. And so what that means is we are going to have different candidates available to us. We have AstraZeneca here at the moment. We are expecting the Johnson & Johnson/Janssen vaccine to arrive as well as the Pfizer candidate to arrive within the next month. And what the study is going to do is we're going to be giving healthcare workers all 3 vaccines. It's not going to be one person getting 3 different types of vaccines, but basically amongst healthcare workers, they will be allocated one of the vaccines, and then we will see how the vaccines perform against in terms of protecting them from developing severe disease. And based on that information, as we begin giving it to healthcare workers, because they are at the highest risk to be able to get that vaccine faster, and we will then adjust strategy based on what we see. Ideally, we want to protect healthcare workers. We want to give them anything we can to try and reduce their burden. And so this is the best way forward to do that, while also answering some key questions about how to proceed with our overall vaccine rollout.
Aisha, just looking at vaccines, and we know that many of these vaccines obviously have been fast-tracked as a result or as a consequence of the severe problems associated with the pandemic, and this debate obviously will be taking place right across the entire world in terms of which vaccine is most effective. And interestingly, last week, we even read about Sputnik V saying that at this point in time, in certain countries, that the Russian vaccine seems to be very, very effective. But, because these vaccines were basically fast-tracked, and there are many unknowns in terms of, how effective these vaccines are and which vaccine is going to work, best for which variant. And until that happens, obviously, looking at where we are in South Africa, it actually makes sense that, we don't place total reliance on a particular vaccine.
Yes, I think it's absolutely true. We've seen with the variant that we have currently, the 501Y-V2 variant, is much more transmissible. And so what we saw was, an exponential increase in cases during our second wave. And that's because there's also some concerning sort of initial evidence which is showing that if you got infected previously with the old version of the virus we had circulating, you might not be protected from the variant. So, we're in a bit of a concerning situation in terms of containing our epidemic because of the variant changing the dynamics that we have at play. So it's really important that we don't see this vaccine as some kind of silver bullet that's going to come in and magically fix everything. We need to be prepared to continue taking other precautions. We need to be wearing masks. We need to be physical distancing. We need to be washing hands and sanitizing. We can't just expect the vaccine has arrived and now it means that all other precautions go out the window. And then I also just want to emphasize, that while we have seen this new information that the vaccine offers less protection against the variant, it's still really important that people recognize that these vaccines are safe. They were fast-tracked in terms of approval, yes, but there is enough information and data available from the clinical trials which show that these vaccines are safe and effective in certain settings. And even against the variant, we have seen protection in South Africa from some of the vaccines. For instance, the Johnson & Johnson vaccine had a 57% efficacy in South Africa, even with the variant in circulation. So it's not that the vaccines have become completely pointless. And, as I've mentioned earlier, the key is anything that can help is useful. And so even if it's only offering 50% protection, for healthcare workers, that's still 50% more protection than they had. And so I think while we have to be cautious and we have to, stay on top of the new information that's emerging, it doesn't mean that we throw the vaccine plan out the window. It doesn't mean that people shouldn't take a vaccine. These vaccines are still safe and they are still worthwhile as part of our overall strategy in combination with other prevention measures.
Yes. Now, also, I think what is something that we need to obviously be aware of, and we've seen the health minister make this announcement that, a warning, we could possibly have a third wave. And this is obviously another aspect that one needs to be watchful of, Aisha.
Yes, and I think the key thing here is, even if the information about the AstraZeneca vaccine hadn't emerged yesterday, we still would have been expecting a third wave. And that is simply because as vaccines work, essentially what they're trying to do in a population is they're trying to get enough people immunized so that the virus can no longer circulate in that community. And that's why you read this thing called herd immunity, which is basically like there's more people who have protection against the virus than the people who can get infected by that virus. And it reduces basically the outbreak in the country and helps control the epidemic. So with the vaccines that we had available, which was going to be 1.5 million doses of AstraZeneca, that was only going to be enough to cover healthcare workers. So it was going to protect them in their line of work. It was not going to get us to a point where we had herd immunity as a country. And so what that means is we still would have had the virus circulating within the country. And the reality is we still would have had a third wave, even if we had vaccines rolled out, as soon as next week. So this is a reality that we have to be prepared for, that this virus is not going to magically disappear. We should be expecting a third wave within the next few months. I think they're estimating maybe by June or something. And so that's also why it's extremely important that we continue to take the necessary safety measures and we don't try and revert back to, a normal kind of life. We have to get used to living with this virus within our society and taking the necessary precautions to not just protect yourself, but also protect others around you who are vulnerable.
Well, Aisha, we thank you for your time with us on News and Views this morning. Please take care, look after yourself, and all the best to you.
Thank you so much.
Aisha Abdool Karim us this morning talking about the vaccine, the AstraZeneca vaccine, which is now being discussed as being less effective against South Africa's COVID-19 variant. And she is with the Bhekisisa Centre for Health Journalism.
Discover the Africa of your dreams and